This is the news in brief from the United Nations. UN Chief António Guterres urged member states on Monday to make swift progress on discussions about weapons that can choose their own targets, so-called lethal autonomous weapons systems. In comments to the review conference on the Convention on Certain Conventional Weapons meeting this week in Geneva, the Secretary-General encouraged participants to agree on restrictions for certain types of autonomous weapons. Humanitarian actors argue that warfare waged by artificially intelligent machines is unethical and puts non-combatants who have already been affected by conflict at higher risk. The aim of the convention is to minimise suffering and to provide rules on the use of specific weapons such as drones, landmines, incendiary devices, lasers and unexploded remnants of war, such as improvised explosive devices. Greater investment in non-communicable diseases like diabetes could save the lives of 7 million people by 2030 and also reduce the impact of COVID-19, the UN Health Agency said on Monday. 7 out of 10 deaths globally are caused by these preventable illnesses, which include heart disease, cancer and respiratory sickness, the World Health Organization (WHO) has said. Some 85% of the premature deaths caused by these non-communicable diseases happen in low- and middle-income countries. This is a terrible health and economic toll, especially on countries that can least afford it, said WHO Global Ambassador for Non-Communicable Diseases and Injuries, Michael Bloomberg. In a message to health authorities in 76 developing countries, the WHO said that if they spent $1 more on prevention, they could see a 7-fold return on that investment by 2030. That's worth $230 billion. These measures include campaigns to lower tobacco and alcohol consumption and prevent cervical cancer. But WHO's recommendation is to implement a combination of measures at the same time for maximum impact. The COVID-19 crisis has laid bare worsening access to healthy food and nutrition in Europe and Central Asia, according to a new report from the UN Food and Agriculture Organization, FAO. It says that the pandemic has pushed back 2 decades of progress in combating undernourishment in both regions, with more than 14 million people either moderately or severely food insecure during the first year of the pandemic. National and sub-regional inequalities in access to food and nutrition are certain to grow, warned FAO's Vladimir Rachmanin, who noted that pandemic policy responses varied greatly across Europe and Central Asia according to each country's level of wealth and political will. On average, undernourishment and severe and moderate food insecurity rates in Europe and Central Asia are much lower than in the rest of the world. The UN agency said that the outbreak of the coronavirus pandemic and disruptions to markets, trade and food supply chains caused countries that were already vulnerable to become even more so over the course of 2020. Daniel Johnson, UN News.